Hello everyone. Today we are going to talk about Spanish flu of 1918. Now this was one of the most deadliest pandemic the world has ever seen. In this video we are going to talk about some of the characteristics of this flu, how it spread, and some parallels with COVID-19. Now the virus for Spanish flu was zoonotic in origin, that is, it originated from animal. Now this virus has been termed as H1N1 virus. And upon analysis of this virus, it was found that, there's a hypothesis that this virus is avian in origin, that is, it originated from birds. Now the second thing about Spanish flu was its origin is uncertain. Now, though the name says Spanish flu and you might get confused that it maybe began in Spain, but that is not true. It's called Spanish flu because it was first reported by Spain. So the thing is, this virus originated during the World War I as it was going on, and Spain did not participate in the World War I as such. While the other countries such as US, UK, Germany, they were all busy fighting the war, the news of this influenza breakout was not a priority. And thus when Spain first reported this influenza breakout, that is H1N1 breakout, the world started to know this virus as Spanish flu virus. So the origin is uncertain. Experts believe that it may have originated in US, UK, or even China. Now another characteristic about this virus is that it affected younger population. So the healthier people were more likely to get infected. Maximum death have been seen between people aged 20 to 40. Otherwise, children below the age of 5 were also infected. So these are main three talking points about the Spanish flu. Now talking about its spread. So unlike today, earlier the world was not as globalized, so the means of transportation was less. But since this virus originated during the World War I, you can see the soldiers, they are fighting the battle inside trenches. This is a closed space. If one of them gets infected, the virus might spread to others as well. And it wasn't that only soldiers of one country were fighting. So the army was mixed up from many other nations, such as the British, they enrolled Indian army as well. So Indians, they went abroad and they fought the war. And when they returned, they brought this infection along with them. Now here you can see a ship carrying soldiers. Now these soldiers, again, if one of them is infected, it's highly likely that others will be infected as well. And these soldiers, they traveled across the border since it was a global war. So these soldiers, whenever they went somewhere or when they returned after the battle, they spread the infection. Again, this is a scene from one of the medical facility of patients infected from this virus. And the same we can see here. So as I said earlier, it is one of the most devastating viruses that has ever infected us. Now let's look at the number of cases. We'll compare it with COVID. So as you can see, COVID has infected 175 million people so far. So this is as per the government estimates across the world. And Spanish flu, again, this number is not accurate, but it is estimated that it infected 500 million people. So the difference is roughly 3 times higher. And mind you, the population of world right now is approximately 7 billion. At that time, it was 1.5 billion. So this flu almost infected 1/3 of the world. Now, let's compare the number of deaths. So, in COVID-19, as reported by the governments across the world, 3.7 million people have died. While in the World War I, 20 million people died. Whereas Spanish flu is estimated to have killed 50 million people. This is 5 crore. Now, in India alone, Spanish flu is reported to have killed 1.2 crore people. So that's like roughly 11 or 12 million people died in India. It was also known by the name as Bombay fever in India. So as you can see, the world, when it was concentrating on World War I, the number of casualty was 20 million, whereas a virus killed 50 million, and yet it is not as known to us. Like, I'm sure majority of people didn't even know about what Spanish flu was. We didn't read it in our textbooks. So this is ironic. Now, parallels and some lesson to learn from the Spanish flu and COVID-19. So first of all, there's no standard protocol. Despite facing an influenza breakout in 1918, we didn't learn our lessons. We didn't have a protocol where if an epidemic arises, we don't know how to tackle it. There's no proper chain of commands. Things have to be reestablished again. Like India had to invoke acts like Epidemic Diseases Act and Disaster Prevention Act. When the National Disaster Management Act doesn't even talk about epidemic as disasters as such. So we need to have a standard protocol to tackle such situations as well. The second is failure to predict human behavior. Now, even the Spanish flu, the second wave was very deadly. What happened was when people were made to wear masks and social distancing was practiced, once the first wave started to die down, people rejoiced, they met each other, they crowded the street, and then began the second wave, which was the deadliest wave of the Spanish flu. So there's a failure to predict human behavior, and we didn't learn this lesson from Spanish flu that second wave was the deadliest. Same thing happened here when the number of cases in India, as you can see, declined a lot in January. Like I think by mid-February it was less than 10,000 cases a day, and people were very relaxed after that. Also vaccines came out, that also made people a little lax. So this was not predicted that suddenly there will be a surge that within 2 months from 10,000 cases we will reach almost 450,000 cases a day. Another thing is the government should have focused on fear mitigation. Okay, so this is another reason. Many people, they don't get treated or they didn't even get tested because they felt that they'll be isolated in a corner. So this, unless and until we test people, unless and until we determine the cause of their ailment, we cannot treat it. So that is another thing. And lastly, clear and transparent information dissemination. So lack of this can again cause fear in people and confusion. So there should be a proper protocol that should be clearly given to people. This was seen at the time of Spanish flu as well in United States. Like people were confused, why is Red Cross Society functioning but churches are closed? So they need to know what is happening, why certain thing is allowed and why the other thing is not allowed. And again, like things like people disposing dead bodies in river. So we read some news regarding this, that dead bodies were found floating in Ganga river around Bihar UP border. The same thing happened during the Spanish flu breakout in India, where rivers were clogged with dead bodies. People, they disposed of their dead because there were not enough cremation facilities around. So these are some of the things that we should learn, like preparedness. So have good medical facility, create proper and standard protocols, understand that humans are social creatures and they will try to spend time together, especially after a period of wearing masks and social distancing. So the relaxations, even if they are offered, they should be a bit more stringent, and we could maybe have avoided the second wave. And lastly, information asymmetry shouldn't be there. So people should know what is being done, what is happening. And A final thought on this. We read about world wars, both 1 and 2. We read about 7-year global war. We read about Kargil war. We read about India-Pakistan war of 48, Gulf war, 6-day war between Israel and Arab nations. But our school books seriously lack coverage of pandemics like Spanish flu, or the plague in Europe, or the Asian influenza infection of 1957. So I think it is high time that the textbooks are written in a way to include these as well, because history is something where we learn from so that we don't make the same mistake again. And if more people know about these breakouts, they'll be more open to follow these protocols against these infections. So maybe it's time we stop debating about Indian history and which part is more important, and maybe we should focus on learning something from history like Spanish flu and Black Plague. Thank you. Have a good day.